said, okay. And I'm going to say this to you. I don't know who that lady was, but she said, you're going to love her. So I said, okay. And then I looked you up. Your name came up in my chart. It said Jessica. And I said, oh, Eddie. And that's my granddaughter's name.
Oh.
I said, and she's pregnant with our first great-grandchild, too.
Oh, congratulations.
But anyway, I said, oh, it's a woman. I'm excited to have a woman doctor. So I was really excited. And then my nurse, I do know his name, Chris Bayer.
Mm-hmm.
When I told him who I was seeing, he said, oh, you're going to love her. So I'm excited to meet you.
Well, likewise. How are you feeling?
I feel fine. I mean,
Okay. How's the chemotherapy been going? Do you have any side effects from that?
the only thing is I'm very fatigued when I'm on it. I haven't had chemo since March the 7th.
Okay.
So I haven't. I kind of wondered, if that March the 11th I had a scan, and I had this scan yesterday.
Mm-hmm.
If there's a change, or if I don't even know what those tumor numbers had been until I saw that one yesterday on that blood work. I don't know what those are.
Yeah, because had you gotten them drawn? I had seen an initial number from your other hospital that was like 193 or something like that, but that was
that would
kind of a long time ago.
That would have been probably December the 13th.
Mm-hmm.
But Dr. Reynolds in Montgomery, who's my oncologist in Montgomery, Alabama, Montgomery Cancer Center, he took a test on March the 7th, the blood work.
Okay.
And he said my numbers were high, but I didn't know what they were.
Okay. And how is eating going okay? Are your bowels moving okay? You're not having any? Okay.
I have a bowel movement every day. I'm hungry. And I'm eating.
Yeah. Well, that's good. Well, you have what seems to be a fairly aggressive tumor.
So it's grown.
It's not drastically different in the short interval between your CT scan, but I would just say that globally, it's evident from the fact that you had a PET scan that had those lymph nodes that lit up. The fact that you do have some growth, and that it's had some growth even when you've been on chemotherapy.
Yes,
it seems like.
Yes.
And that's really a disappointing result, right?
It was for us,
yes. That might make me start crying again.
Oh.
To go through that awful mess.
Yeah. Your tumor is technically removable with an operation, but I think that surgery is not going to offer you the outcome that you want, which is potentially cure. And what surgery requires is at least 2 months off of chemotherapy, because you have to be done with chemotherapy at least a month before you go to the operating room, and you'll need at least a month, sometimes 2 months, depending on how well surgery goes and how well people bounce back from it. And that gap of no chemotherapy for a tumor such as yours could have fairly bad consequences in terms of your overall picture, right?
Okay.
So I'm concerned that would be, that we would, cause
That's
harm.
what we would run.
That we
Cause
would
more
cause,
harm
yeah.
than good. Okay.
Particularly because I am, you had that PET scan back in January that showed that bright lymph node.
Mm-hmm.
And that technically constitutes stage 4 disease, right?
Okay.
That's metastatic.
Okay.
And the reason that distinction is important, particularly when we're considering an operation, is that it kind of, once we move into stage 4 territory, it also kind of takes us away from surgery being curative, right? And so then we have to ask ourselves what the potential benefits are if the risks are that it could grow, and we know that it could grow in other spots, right? So in our CT scan, our radiologist sees the lymph node that had been bright on your PET scan, but there are also other lymph nodes in the area that look somewhat suspicious.
Okay.
And when we're in the operating room, we can't tell. Like, those aren't normal lymph nodes that come out with the surgical specimen when we do a Whipple. And so it would be, difficult to be able to clear all of those lymph nodes in that metastatic disease. And particularly in someone with metastatic disease, the treatment, the way to keep your tumor under control is chemotherapy, right? Because theoretically it circulates in your blood and it has the potential to affect all of the cancer cells at once. Whereas my operation I can only remove either what I see or what is a standard part of a Whipple.
So what you're saying is then there would be lymph nodes left in there, that
Right.
the cancer would still be in.
Right.
It's aggressive cancer, so it would just start growing.
Right.
Growing.
Right, and exactly. You wouldn't be able to get on chemotherapy very quickly, right? Because
Right.
of this big operation. And we could make you worse off.
Right.
Well, that helps explain
Yeah, we didn't
that
understand.
we didn't really understand why surgery was not an option.
I see, yeah.
And that was a question mark we had that was never really explained to us, but we never had a chance to meet with the doctor, so it was just unclear, because going into the chemo and all there was a question mark about the lymph node, but it was suspect, it was not definite.
Right.
And even the last CT scan on March the 11th, there was still a question because it did not show up on the CT scan there was any lymph node issues. And then they told us, surgery was not an option, but we just never fully understood that. But so what I'm hearing is there's still questions about the lymph node factor.
Yeah, and in addition, we have, our CT scans are of pretty good quality, so we often are able to see sometimes some more detail than what may otherwise be detected in other scanners. No offense to anyone else.
Yeah, can you tell how much it's grown since March the 11th?
Yes, I do believe Dr. Tam would measure that. So you will have access to this radiology report, and we're also happy to print it for you as well. So it currently is 4.2 by 3.2 centimeters. And in the January study, it was 2.5 by 2.3. So over, 2.5 months, it's grown 1.5 centimeters or so, depending on the dimension in which you're looking.
Plus it's grown
Since March the 11th, it was 3.9 by 3.6 by 3.6.
And there might be some differences in the, measurement.
Yeah.
Just because of differences in CT, but
Yeah.
you're
Yeah.
correct. I think that there's been a continued march of this tumor.
She's been off chemo since the last 3 weeks.
3 weeks Friday.
Because of tolerance, or?
Well, I think he was I don't know. I think it was my birthday week. I said no chemo that week.
Sure.
So then the report came back, so sorry.
It's okay.
He referred me to here. God, please, I can't remember.
Yeah.
I got one.
Okay.
One.
All right.
Anyway, I'm sorry. I get
Don't you
emotional.
apologize.
Most of the time I don't. I'm pretty strong. But I think he was waiting. We were going to do it this week.
Okay.
And I showed him the drugs. I can't. What did Jim send?
Gemcitabine and Abraxane.
Yes.
Okay.
That's what he was going to try next.
Okay.
And so that's where we were.
Yeah.
So when he called me, I said, "Well, I'm going to MD Anderson. Let's see."
Well, at the last
What they would do.
visit with him, he recommended we come here, and then at the same time, he indicated that we would start another second round of chemo, second level, I believe he
Okay.
said, and then
He called this the second line.
there were like two different efforts going on at the same time, we fortunately were able to get in here quicker than I think he realized.
Mm-hmm.
But he would have started that chemo
This week.
if we hadn't been here,
Okay.
so.
Okay. Okay. What other questions do you have?
What options are we looking
So it looks like you're meeting with Dr. Willis.
Tomorrow morning.
And
And thank y'all, whoever got us in, cause they had us like next week on the ninth, and I'm like, oh my gosh.
yeah, no problem.
I love you, but I'm ready to go home.
Yeah.
I live out in the country and I have a big lake I look at every day, so I'm just ready to go home.
Yeah, I don't blame you. You know, Dr. Willis will be able to kind of talk to you about what other options there may be. And I will, you know, send him a note tonight or give him a call tonight just to let him know about, you know, what we talked about. You know, I think the next line typically is exactly what your oncologist has planned for you, right? Once we're done with FOLFIRINOX or for whatever reason, you know, the next line is gemcitabine and Abraxane. You know, and the chemotherapies that are beyond that are not, you know, usually where we start. So I think that this is a very reasonable next step. You know, usually, as you probably had been doing with the FOLFIRINOX, you take a couple months, right, of the chemotherapy and then get another CT scan and then take a look, get, you know, repeat blood tests as well. CEA, CA19-9, just as you had been doing. And that's how we would gauge response, would be both based on the CT scan and also based on your tumor marker levels.
So the tumor markers, you just take those every couple of months, or do you take them every?
We don't typically do them more than,
Every time, okay.
yeah, we do them every time we get a CT scan.
Okay, oh, okay.
Because it doesn't really, it wouldn't change what you're doing probably, you know,
yeah.
I don't know that most medical oncologists would stop after like a month only of chemotherapy or something like that, so you.
Giving it a try, yeah.
Does the Lynch syndrome factor come into play as far as diagnosis and how this could be treated?
I don't think so. I mean, it looked like you had some genetic testing.
Right.
Yes.
And so that would kind of guide some type of therapy options. But at this point, you know, we're really kind of just looking at standard therapies.
Because initially they indicated somewhere along the way that we caught it early and it was encouraging, but then things kind of accelerated.
Yeah.
Yes.
And so it doesn't sound like we caught it soon enough, maybe.
Well, it's hard to catch any cancer soon enough.
Yeah.
Well,
We've read, and our daughter-in-law is a nurse practitioner. She's done some research and looking into this. You know, there's been some trials for pancreatic cancer vaccines post-surgery. Kettering in New York. They've had some trials, but I'm talking about something I don't know much about here, but I know they've done some trials, and I don't think they've been fully successful, but evidently this pancreatic cancer in these trials, they take the tumor, send it to a lab in Germany, and they do some testing, and they develop a specific vaccine for the individual's pancreatic cancer. So are there any options along those lines?
We have that trial open here.
You do?
it has to be post-surgery.
But that's it.
So that's not even, I don't even qualify for that one,
But there are other trial options that we have open, and Dr. Willis is, you know, a part of many of them and can help kind of talk you through, you know, what options may be available. Often you know, a lot of trials aren't available until you've completed first and second line therapy, because we want to make sure that patients are getting the best therapy that we know of,
Right.
and then move on to things that we may have more questions about, right, where we're not 100% sure on how efficacious it is.
How many of these next chemos would you suggest I need to have?
I think that's up to Dr. Willis
Yes,
and your
okay.
medical oncologist. I mean, of course, 2 months for sure,
Yes.
right?
Okay.
Get 4 cycles under your belt and then see where we're at.
Now that'd be every 2 weeks again, wouldn't it?
Yeah, it's either every 2 or 3, depending on which medical oncologist you
Okay.
have and how they like to dose it.
Okay. It's not easy.
No, it's not, I'm sorry.
So the bottom line for the surgery not being an option is just basically strictly based on the fact that it's so aggressively growing.
Right.
And
And
that's,
if we stopped therapy, it could,
Yeah.
it could give the tumor the opportunity to spread further, right?
metastasized.
Correct.
But at this point, it's not metastasized.
Well, it is metastasized to lymph nodes.
Well, yeah, maybe.
No, it showed up on this CAT scan.
Oh, it's on this scan?
Well, we have lymph nodes that are large on this scan, and they correlate with the bright node that we saw in January.
I see.
So, okay. Wow.
So right now, the chemotherapy is key.
Well, I met a lady's husband here yesterday, and her first chemo didn't work either, like
Mhm.
mine, and they put her on this. I can't say those words. I'm an accountant, not a doctor. And anyway, she had her scan yesterday, but her tumor markers have been coming down.
Mhm.
She was over 1,000,
Mm-hmm.
and hers has come down. Hers
Yeah.
was 500 and something. So.
Yeah.
But I don't feel bad. I
That's
mean,
good.
it's
That's
weird.
really important.
Yeah.
That's great. And it's important that you maintain hope, right?
Oh, I do. There's one healer. Dude. It's just hard to hear it.
I'm sure.
Well, I go for sure. See that great grandbaby this summer.
Absolutely.
Okay, so we see Dr. Willis tomorrow.
Mm-hmm.
Okay.
Yeah.
But our chemo can be done at home.
Correct.
We don't have to come
Correct.
out here
Yeah.
for that. Okay. Well, I can thank you.
Hang in there.
I will.
It's good to meet you.
I would sing for y'all, but I don't know if I can. I used to sing for you. Hold on. Let me see if I can get it together. Lord bless you and keep you. Make his face shine upon you and be gracious to you. The Lord turn his face toward you and give you peace.
Thank you.
I usually can sing it, but I can't right now.
Thank you.
God bless you.
Hang in there.
I will.
Okay.
I don't, trust me, I'm not sitting around crying all day long.
Well, good.
This is just
It's hard.
hard.
It's hard. It's hard to talk about it.
Yes.
Thank
Yeah.
you, Dr. Maxwell.
Yeah. Best of luck with your future treatments. Okay.
Nice to meet
Thank
you.
All right, guys.
Nice to meet you.
Okay.